So about 3 years ago, I started experiencing joint pain in my hands and my feet. Went to my doctor. They recommended I go to see a rheumatologist. Ended up getting diagnosed with rheumatoid arthritis, and have been kind of dealing with inflammation in my hands, my feet, most of my joints for about 3 years now. And then fast forward to this year, it started to happen in my jaw. So went back to my rheumatologist, was having horrible headaches, jaw pain. I was really struggling. And their answer was kind of just to put me on meds and see how it could help me. But they wanted me to go see my dentist first, because I thought, well, if it's a dental issue, we'll take care of that first. So I came to the dentist, and wasn't sure what they were going to find. Never had any dental issues before, so wasn't sure what they were going to say to me. But they did the cone beam scan and realized that I was a clincher, so it was kind of figuring out that there was something that was going on, just besides the inflammation and the swelling and the pain, that there was actually a reason for it. So when I came here after I was having horrible pain, Dr. Villafane did a cone beam scan. It was actually a really interesting process to see. They took images of how I stood and cone beam of my whole head and jaw, and it was kind of interesting to see that I clenched so much that I wore my jaw down, and luckily Dr. Villafane is a clincher too, and so he knew kind of what to do, what to help me with. So they made me I kind of call it a mouth guard, but it's an appliance that I wear that puts space between my teeth, so I wasn't clenching, or at least getting my jaw to clench fully. And it was almost instantaneous that the pain was gone in my jaw, and after a few days, I didn't have hand swelling, I didn't have pain in my feet, and I felt like a whole new woman. So yeah, it was between the daytime appliance. So what they did is they fitted me for a mouth guard that it's a 12-week appliance that I'm now weaning off of, and then a nighttime appliance, because they kind of figured out that I clench mostly at night. Apparently I keep a lot of stress in my jaw. And so between those two appliances, they have me feeling much better. I'm getting to the point where I'm weaning off, so I'm not wearing the daytime appliance anymore. I'll continue to wear the nighttime appliance, which is totally fine with me, because I'm feeling way better. I don't have the pain in my hands. I don't have the pain in my feet. One of the things I struggled with was I couldn't walk or lift weights and not be in pain later. And since I've used the appliance, I haven't had any of that. So I'm feeling pretty awesome. Since treatment, I have been able to work out, and I haven't been able to do that for 3 years. I've been able to lift and go on walks every day and just feel good. That's just in my daytime life, but even the nighttime appliance, I've been able to sleep well. I feel rested when I wake up. It's definitely overall made me feel a lot better and given me kind of a better better feeling in life in general. Been able to play with my child too. And I would highly recommend, if you know you're a clincher, if you don't know you're a clincher, to come see Dr. Villafane. I've recommended him actually to my father, to some of the ladies I know that have RA. You know, he really took the time to listen and figure out what was bothering me, and to do all the scans, and he listened, which was the biggest thing. That, you know, I've been having this pain for years, and the fact that he took that time and it's gone is awesome. Like, there's nothing better than that. And I really recommend listening to him too. With the mouth guard, you know, it was definitely a weird experience. You know, something in your mouth that doesn't let you bite down fully. It definitely is a little challenging at first to figure out how to eat with it, but you know, if you actually do what he says, it's completely changed my life. So I highly recommend coming to see Dr. Villafane and doing the treatment and actually doing it correctly.